So next, I have an amazing opportunity to introduce our next speaker. We have Dr. Stephanie Norris, who owns several clinics. She runs several clinics. She is a PhD prepared psychologist. She does amazing work. She's also a dear friend, and she's going to talk to you about a topic that isn't very fun to talk about, but it's important. So she's going to talk to you about depression and anxiety. Please welcome Dr. Stephanie Norris.
Hi, everyone. Thank you, Alan, so much. I'm so excited to be here today. Okay, let me see if I can figure this out. There we go. Today, we are going to talk about anxiety and depression as it specifically relates to lung patient health. So everything that we are going to talk about today has been taken from the research. I am a research nerd. I am constantly in the research, and so everything related to anxiety and depression that we talk today about is going to be related to lung health patients, okay? I am gonna throw some general facts out there for you. So let's start with some lung health facts. Genetics plays a role in lung disease, asthma, lung cancer, COPD, but there are so many different types of lung diseases, right? We have pneumonia, we have pulmonary disease, many different forms. We don't just have lung cancer. Radon is the leading cause of lung cancer in non-smokers. In smoking, so if you smoke, 1 in 3 individuals will be diagnosed with lung cancer. Secondhand smoke, now you have a 20 to 30% chance, increased risk of getting lung cancer, but you have to be around secondhand smoke excessively, you guys. This is not just being downtown, walking by somebody who's smoking. This is living with an actual smoker, or having someone in your family, maybe one of your caregivers is a smoker. Symptoms of lung disease are not always obvious. They are very kind of slow and progressive. Kind of starts with kind of out of breath. I couldn't run the entire mile that I normally run. Wow, it's really kind of tricky to finish my grocery shopping today. It's typically how it starts, slowly progresses into more serious issues. Let's connect mental health with lung health. Depression. I absolutely love talking about mental health. Depression, there's 3 primary kind of causes, if you will, to depression. Number 1 is genetic. Depression and anxiety are the most highly genetic mental health disorders. If you have mom and dad that have depression or anxiety, you are 50% likely to get depression yourself, to have some symptoms of depression yourself. If your mom and dad have depression, you are 75% likely to be diagnosed with depression at some point in your life, okay? Temperament plays a role as well. What is temperament? It's kind of that irritability within you. You're just kind of irritable, and you all know somebody like that, right? I'm sure you have somebody in your life that's just a little bit more irritable than normal. And then we have environmental factors. This is COVID, to be honest. 9/11, all these things that have happened in our world, okay, plays a significant role. Oops, am I going too slow? Sorry. Highly comorbid with anxiety. You can think of depression and anxiety as twin sisters, okay? That's how I kind of want you to think of it, because if you have anxiety, you typically have depression. If you have depression, you typically have anxiety. There's a very high suicide risk, high mortality rate with depression specifically. I'm going to talk more about suicide in a moment. I thought I'd throw some fun facts out there. Prevalence rate is 7% for the general population. Females are more likely to have depression and anxiety, just so you know. I think the data is a little bit skewed because most men don't go to treatment. Most men don't go to their doctor and have medication or have conversations about their depression. More women actually seek treatment than men. So, my own bias. What are some symptoms of depression? You guys, this is specific to lung health, okay? It also is specific to the general population, but I want you to think about this from a lung health perspective, from a disease perspective, diagnosis. You become more tearful. Maybe you cry at the commercial, you cry at the movie, you cry at the result, you cry at the news that your doctor just told you. You just become more tearful. You're irritable again. You have a lot of unhappy thoughts. What's going to happen in my life? What about my future? I had all these plans for my future, and now all of a sudden, it's like a blank slate. I have to start over. What am I going to do? It's just very unhappy thoughts. Obsessive rumination, we actually technically call that fixation in our field. This is where you just fixate. You fixate on a certain aspect of your disease, of your symptom, of your lack of capacity, of your life changing, of your caregiver being upset today, and you're wondering, are they mad at me? Are they done with me? Have they had enough? That's obsessive rumination. Anxiety we'll talk about later. Oh, I am going slow. I'm sorry, I'm gonna speed up. Phobias. This speaks to the question that was asked earlier about panic. This is a serious kind of issue when it relates to lung health. We have very severe kind of fear extremes that are typically outside of the norm, meaning that they don't actually match the situation. That is what I mean by that. Excessive worry. We have complaints of pain. Cortisol is our stress hormone. Sits right behind our ears, guys, or eyes, sorry. And when that is released, that oftentimes we get headaches. Well, there's a direct nerve to our spinal cord. So we often complain of neck pain, back pain, leg pain, joint pain, because our depressive symptoms become so excessive. And then we have a separation anxiety from family. This is tricky because when you are leaving, if you will, for that doctor's appointment, is this the last time you're going to realize that your illness is now terminal? And you start to have this panic, you start to have this fear, you start to have this sadness that won't go away, which leads to suicide. And I'm not minimizing suicide in any way, you guys, so do not hear me say this. Suicide is a coping skill. That's what it is. Because when we have so much sadness, so much pain, just so much devastation and loss in our life, we start to think, wonder what it would be like if I wasn't here. Wonder if anybody would notice. Wonder what people would say at my funeral. That turns into, I could take some pills. I have enough of them. I do have a gun. I do have some rope. And that turns into, well, everybody's going to be gone next month on a trip. I could do it then. I could do it tonight. It's very, very normal. I want to normalize suicidal thoughts. It's very normal to feel them. Now, it isn't the healthiest coping skill. Let's be real, right? But it's normal because that is depression. Truly, you guys, that is depression. Okay, let me see. Anxiety. Let's talk about anxiety. So anxiety is the same as far as the cause as depression, except anxiety has a negative affect. What does that mean? It just means that you're just kind of that Debbie Downer. That's what it means. Nothing kind of goes your way. You're always just kind of upset. You're always just kind of like down. All your thoughts, all your verbalizations match that kind of affect, if you will, okay? You worry about a number of things. It's difficult to control your worry. So this is what happens when you become panicky. When you start to worry and you get into a spiral and you go, okay, I've got this doctor's appointment and they're going to tell me that this is now terminal. They're going to tell me the treatment didn't work. They're going to tell me that I will never be at the same lung capacity that I ever was before. And then you go, and then I won't be able to take trips to Florida to see my family. We won't be able to do those family vacations anymore. I used to hike. I used to ski. That's over. And when that's over, what am I going to do? How am I going to have activity and fun in my life? And then that turns into something bigger, which turns into something bigger, which turns into something bigger. That's what we call anxiety. That's what we call panic. Prevalence rate, again, 3%, more females. Again, I think it's skewed, but that's my own personal bias. Vicarious trauma. This was pretty commonly found in the research with lung patients, and I think it's really an important topic because hopefully every single one of you has this amazing support system that is helping you. And vicarious trauma becomes an issue. And what does that mean? It's an individual that is just being exposed to your trauma, to your story, to your issues, to your doctor's appointments, to your treatment plan, to your medical providers, to your issues that you are constantly having, to your panic, to your depression, because all they want for you is to be okay. They just want you to get up. They just want you to get out of bed. They just want you to get moving. Maybe watch a show. Vicarious trauma is a real thing, and it's very impactful to caregivers. There's some factors that increase our risk to developing vicarious trauma as caregivers. And frankly, as a medical team, honestly, anybody that works with lung health patients has a higher risk of developing vicarious trauma if you have negative coping behaviors. So what are some negative coping behaviors? That could be like drinking to relieve stress. It can be overeating. It can be sweets. That's my thing. And so it can be anything that you do that's maybe not the healthiest thing for you. It can just be having like a negative affect and just kind of talking about what is not going right in your life and just focusing on that. Another one is lack of social support. I'm going to talk more about that later. And then instability in your non-work related life. And according to the research, the number one instability factor that is going to increase your risk by over 80%, relationships. Unhealthy relationships in your life. People that don't support you. People that do not meet your needs. People that perhaps are more selfish about themselves than about you. People that are inconsistent, and they are perfectly inconsistent in your life. Those are all factors, but that is the number one as far as the instability. I want to talk about PTSD. This is the very brief DSM diagnosis for post-traumatic stress disorder. I'm not going to go into all of them. I'm only going to highlight the ones that are relevant to lung health patients. Number one is just experiencing a life-threatening event. And when, I mean, let's be real, when we get the news that we have suddenly this lung disease, it's pretty life-threatening. Your whole world changes in just like that, right? And so we have intrusive thoughts. We're constantly thinking about our mortality. We're distressed. We suddenly go from here on our stress level maybe, I mean, life is more like this, but you know, we're kind of here, to all of a sudden we're here. And we stay here. We have dreams. We disassociate. We just kind of like remove ourselves. That's not me. Nope. Nope, not today. We spiral our anxiety. We just kind of like take a deep dive because it actually releases our anxious symptoms, you guys. It makes us feel better. So now you've just trained your brain to constantly spiral to make yourself feel better. Normal. Those are kind of the, I would say, top symptoms, if you will, as it relates to lung health. Irritability, anger, self-destructive behaviors, sleep issues. Lots and lots of sleep issues. Sleep impacts our mental health so significantly, causes an increase in our depression, increase in our anxiety, and an increase in our PTSD symptomology. Really, frankly, it causes an increase in any issue that you perhaps struggle with, to be honest. Because we just don't have the capacity, the executive functioning capacity in our prefrontal cortex to be able to make decisions in the moment that can pull us out of anxiety loops, or can pull us out of bed, frankly, if we're experiencing depression, or pull us out of the loop of suicide. That's a tricky one once that starts. So let's talk about some consequences. I've talked about the top four, but substance abuse and low self-esteem I just want to highlight. Substance abuse is so easy to obtain because, man, you have a drink and you feel better. I mean, it works. That's the reality. But then we build a tolerance and suddenly we need more and more of it. And if we have relationship issues in our life and they are perfectly inconsistent, it becomes so much easier for us to drink more. Low self-esteem is a big one in lung health patients because, man, your whole life has changed. It's tapped your self-worth. Your self-worth consists of your low self-esteem, I should say your self-esteem, and your self-efficacy. Self-efficacy is our ability in our performance. It's our belief in our ability in our performance. That just gets shattered because you no longer have the same lifestyle. So we now have just impacted our self-efficacy, which has a direct link to our self-esteem. And we suddenly feel bad about ourselves because we can't do the things that we used to do for our families. We can't show up in the same way. And we maybe start to feel bad about our own selves because we don't just have like an active lifestyle anymore. And so that really does impact our self-esteem, and we feel like a burden. Massive burden. And we go, gosh, if only I could get a cure. If only I didn't need this person as much. And it does really start to impact our self-esteem. Some protective factors. I love that the doc prior to me talked about moving your body. That is number one. Move your body. What we eat and sleep. Those are the top three things to reduce any mental health symptomology truly in overall, like just overarching Having a strong medical team, I just want to talk about that, and a family support system. Wow, the research on this, you guys, if you have one person in your life that is consistent, you have just reduced your mental health symptoms by 28%, only because you have that person right here next to you. That's how much a strong support system is so prevalent in helping you to overcome your mental health as it relates to this lung disease. The second thing is a strong medical team. I'm not talking about the doctor that comes in and has got the chart and is just like, okay, hi, yeah, you're here, okay. Okay, have a good day, do this. That is not a strong medical team. Please fire them. Please find somebody else. You need a strong medical team to get through this. Somebody that's gonna actually sit and listen to you. Somebody that's gonna like hear you, that takes the time, that maybe says, are you depressed? Are you feeling more anxious today? Somebody that just cares, that shows up for you, that's like, hey, I was doing research on the research and I found this new intervention, this new technique for you. That's who you're looking for. Denver is great for that because you got a lot of options. Actions to improve lungs. I'm really just going to talk about moving your body because I can't tell you how much research has been done on just being active. Now, this is not possible for everybody, right? Because sometimes you just have a bad day. I mean, honestly. But it's baby steps. That's what I always tell my clients. It's baby steps. You just one day, you walk to the mailbox and you walk home. And if you have to pause 85 times, it's okay. Really, it's okay. You don't have to beat yourself up, or you don't have to feel like a burden. It's really okay. Moving your body, eating healthy, trying to get that sleep. You know, this is a fun fact for y'all. Society says that as we age, we don't need as much sleep. It's actually not true. It's actually not true. As we age, we need 8 to 10 hours of sleep. Problem is that most individuals over the age of 70, they wake up in the middle of the night because they have to go to the bathroom. Their bladder control is just not as healthy as it used to be. And so it impacts your sleep. And then once we're up, we're up. Because then we're thinking, well, I got to do A, B, and C today. I might as well get a head start on that list. I mean, really, truly. But you need as much sleep as an infant. Well, maybe not as much sleep as an infant. I'll maybe put it at the elementary level, elementary school. Self-care. I talk about self-care every single day with every single one of my clients. Self-care improves patient outcomes, you guys. I love this quote that self-care is care left undone. How easy is it to be like, oh, I'll do that next week. I'll do that on Saturday for myself. How can I really think of myself when I've been the center of attention this entire time? Self-care is so imperative in reducing mental health and improving our medical condition. There is so much research. What does self-care look like? It can be taking a bath. It can be watching your favorite show. It could be crafting. It could be engaging in a hobby. It could be watching movies, going to shows. I mean, there's so many different elements of self-care. It can be journaling. Journaling is a big one, especially if you have anxiety and depression. It's very, very effective. Most of my clients are like, I want to sit down and write. And I'm like, I get it. Talk in your phone then. Figure out a way to release it, okay? Those are all just kind of forms of self-care. Some factors that impact self-care is kind of our power and our agency. You can think of agency as like advocacy, advocating for yourself. That's kind of what you can think of it as. And if you don't feel that you're important, you're not doing self-care. Depression says you're not important. Depression says you don't matter. So it's so imperative, and I'll talk about treatment in a minute, that you really hone in on that, and that you work to find your voice, and that you use your voice in doing some self-care for yourself. Lack of support's another one. I mean, if we don't feel supported, we're certainly not going to be taking care of ourselves, because we're already taking care of ourselves. We're trying to get ourselves to the doctor. We're trying to get ourselves up the stairs. We're trying to get ourselves to the car. We're already taking care of ourselves. And so the fact of thinking about like doing something extra is near impossible for us. Let's talk about treatment. What do you do with all this information? I love therapy, obviously, because of what I do for a living. But therapy works. 5 sessions, you're 30% better. 26 sessions, you're 85% better. 52 sessions, you are 90% better. Therapy works. Find somebody you connect with. The therapeutic alliance, AKA the therapeutic relationship, is the most prevalent factor when we talk about improved mental health. If you like your therapist, after session 2, you already have a 20% decrease in your mental health symptoms. How do you get access? How do you find therapy? The beauty of COVID, good and bad of it, I guess, it's hard to say it that way, but the beauty of COVID is that we now have therapy via telehealth. You don't even have to leave your room. Go to your insurance panels. Go to psychologytoday.com and put in what you're looking for. Medical issues, whatever it is, anxiety, depression, whatever it is. CBT and DBT, cognitive behavioral therapy, dialectical behavioral therapy. DBT is the #1 effective treatment for PTSD and suicide and vicarious trauma. CBT, #1 effective treatment for anxiety and depression. So I highly encourage you, when you're seeking and looking for a treatment provider, have a conversation with them. We all love that. Us therapists, we love that. We're like, yeah, great, I'll have a conversation with you, because you're going to know instantly if you connect with that individual on the phone. You just know. You do it via Zoom too. A lot of people do that. Look at your insurance panels, because there are so many therapists out there. That's kind of the beauty of, I guess, Denver. It's kind of oversaturated with all of us, which is kind of nice because you get a lot of options. Family therapy is another one. I can't stress it enough. For your family to know what you're going through, for you to understand what your family is going through, it's so imperative for your long-term progress for all of you as a family system, to really hone in on what are some issues, because oftentimes when we have some major news that happens in our life, suddenly the conflict in our family increases and no one's getting along and everyone's irritable. By the way, that's super normal. Super normal. But family therapy can help dissect some of those issues for you guys. Maybe resolve some conflict and gain some communication skills for you. Let's see, paid time off if you can. Oh, that is one thing I do want to say, is that therapists, I do this all the time for my clients. I primarily work with breast cancer clients, just so you know, not lung health clients. But we can write and help our clients get short-term and long-term disability. and be paid a certain percentage with time off. So there's so many different resources and options for you. You just have to ask, or you have to find the right person that kind of knows this world, if you will, the medical world, if you will. Obviously not every part of it, there's a lot, that can really help you. And that is all that I have today. Thank you so much. I'll take any questions.
Thank you so much, Stephanie. And now we're going to have one of our volunteers, Stephanie, run the mic around. If you have a question, raise your hand.
Hey, Doc, thank you so much for coming and talking about a really important issue. A question for you, and I know it's become more commonplace to talk about now, which is really great, just suicide prevention, anxiety, depression. I feel like the older generations really struggled with being able to talk about these things, so I think it's huge that you're here. That being said, in the CBT world, are you seeing more instances of people getting diagnosed with ADHD, especially females now, in conjunction with the anxiety and depression? Because I feel like my patient base is much younger, but when I was working with an older patient base, I'm a hygienist, by the way, but with the older patients, a lot of times I was having patients getting diagnosed, especially females, at 60, 50, some 70 as well. So are you seeing that at all? Thank you.
Yes, we are. I would say that there's been an increase, frankly, in just overall all mental health diagnoses being diagnosed because, way back when, you just didn't go to therapy. Like, you just didn't. Like, there's such a stigma attached. The stigma still exists from the public perspective, you guys. There's new research as of 2023, but it no longer exists. The stigma no longer exists for the internal individual person, which is why we're seeing more people come in and go, hey, Dr. Google, because Dr. Google will tell you whatever you want to know, told me that I have ADHD or that I have depression or whatever. And so we're starting to see more and more of that come in because, again, at that individual level, the stigma has actually been reduced by like 38%, which is pretty high. Yeah. Yeah, you're welcome.
Hi, Dr. Norris. Do you have any information or any experience with the 988 number for Colorado
Crisis.
citizens? Yeah, if they're in crisis for mental health, can you give anybody information about that?
Yeah, there is a crisis line. I will make sure that Alan and Donna have that, and I highly recommend that if you get to that stage, remember when I talked about, you have the thoughts and it turns into a plan, and then that's turning into like, well, I could do it on Friday night. That's when you're going to want to talk, call the crisis. You could even do it during that planning stage as well. They're all kind of being trained in the mental health field, and they are phenomenal. They answer your questions, and they will stay on the phone with you as long as you want, just so you know. I had a client that called because I was out of town. She was on the phone with them for 8 hours. There are no time restraints, so I will make sure that the two of you have that information before I leave. Hi.
Can you hear me?
I can.
Thank you, Dr. Norris, for coming in today. My question is, how can we, what role does gratitude play in depression and anxiety, and how can we practice that more often?
That's a great question. Gratitude you can think of gratitude as another word for joy. We have joy in our life, and we kind of spread that joy. This is where it gets tricky, because depression is on a spectrum, and anxiety technically is not on a spectrum, but I think it should be. And so the more severe that we are on that spectrum, the harder it is for us to tap into our gratitude, to tap into our thankfulness, if you will, for what we have in our life. But there is so much research, you are right, around how gratitude plays a role in decreasing our mental health. But I really want you to think of like anxiety and depression are genetic. We're not getting rid of them, but we are decreasing them. Does that make sense? And gratitude can absolutely play a role in that. It's just a tricky thing to practice because most people don't wake up and say, these are the 3 things that I am grateful for today in my life. Most people don't do that. That has to become like this learned habit, right? That we incorporate into our life, kind of like you get up and you eat breakfast. Most people do. And you just create a habit. Nobody thinks about that. Nobody gets up and says, okay, I'm going to take my leg out of the bed and I'm going to walk down the stairs into the kitchen to eat. It's just so automatic. And gratitude can become the same thing. It just takes a lot of practice. But it does reduce. It's about 18% that it reduces our mental health symptomology. And everything helps, in my opinion. So, hi.
Thank you for this discussion. This really triggers me because I didn't find out I needed oxygen until my mental health was, drastically bad. I woke up every morning for about 2 years crying like a maniac for no reason. And my doctors, my friends, everyone thought I was just losing my mind. Maybe I was, but it was because I needed oxygen. Now that I'm on oxygen and I'm sleeping with oxygen, I no longer wake up suicidal, depressed. I wake up happy with motives, really happy and go about my day. But my doctors put me on antidepressants for years. It didn't fix the problem, it made it worse. Why aren't people in Colorado making this a bigger deal and talking about oxygen and mental health together versus one or the other? Do you know why it's not talked about more?
Yeah, there's several reasons. Primarily, doctors are not, I don't mean this in a bad way, but medical doctors are not trained in the same way that we are. So I can walk into a room and I can have a client walk into my office and within 5 minutes I know what's wrong. They don't even have to say anything. I just know, because that's my training. Medical doctors, you walk into a room and they have a checklist of questions that they're trying to assess medically what is wrong with you so they can help you, right? And sadly, it's very sad, but it's very true. You walk into a PCP, a primary care physician office, you say you're depressed, you say you have anxiety, you say you're not sleeping, and they're going to medicate you. Because the medical field has been trained around medication and treatment. The field of psychology has been trained around, let's change your lifestyle. Let's dig into your past. Let's make connections all over so we can figure out how to best decrease your mental health. So stigma, that plays a huge role, sadly, just the public stigma. And why I would say medical field doesn't incorporate the two as frequently as they should. Lack of training would be number 2, because they're just not trained in the same capacity that we are. I think they are getting better, to be honest. At least that's what I've seen. That's anecdotal though, so that's not research, that's just based on my own experience. And I think that's why I speak to that power and that agency, you guys. Use your voice, because it matters. What you're feeling matters. It is not extreme, it is not dramatic. It matters. Because we don't always have to medicate it. You know, for you, medication didn't work. It made the problem maybe worse, right? And that's the problem, is that most doctors will kind of run down the side effects for you, but they're not looking at that kind of holistic picture like a therapist would or a psychologist would. Does that answer your question? Okay. Hi.
Hi. Thank you for talking about individual versus family therapy. I'm just a little curious in just piggybacking off someone who might not be willing to go into individual therapy, doing it for their family, and how can an individual do family therapy without doing one-on-one? And how is that referral, or how do they get connected? Because it's not put through on that person's name specifically. Does that?
Yeah, it makes sense what you're asking. Yeah. I would say start with family therapy. As a family therapist, unless there is abuse in the family system, and I'm talking about like domestic violence or emotional abuse in the family system, I can see, and therapists in Denver can see an individual out of that family system, because the issue typically relates to the family, right? I mean, the family is coming to me oftentimes. I'll use a breast cancer patient, and they come to me for issues of the medical condition, right? Because it's changed their entire life. I can pull mom or dad out, or kiddo out, and see them individually and develop that relationship enough to then say, hey, I think you need individual therapy to maybe dig deeper into your past, or dig deeper into, this terminal illness that you have, or the potential, or whatever have you. And typically at that point, they're much more willing, because therapeutic alliance, like I said, that relationship is such a strong indicator of termination, like premature termination. It reduces premature termination if we have a very strong connection to our therapist.
So, is family therapy covered by insurance then? If a patient's family needs therapy, does it go through on one person, or how does a family get referred?
To answer your question, yes and yes. So it is covered under insurance, and they will just use one of the family members and submit through their insurance. And I think that if you think about the medical treatment that you all maybe have had or will be having, and your deductible being met, therapy is covered 100%. Nothing comes out of your pocket. So it's a motivator, hopefully, for you guys. And that's both at the family group therapy. If you have a perfectly inconsistent support system, go to group therapy. It's covered under your insurance. And then that individual as well.
Let's give a big hand for Dr. Stephanie Norris. Thank you so much.
You're welcome.
Incredible.
Yeah.